Hello, my name is Dr. Mary Gray Jensen. I'm a medical officer at the Edward Francis Moore Teaching Hospital in Banjul. I'm also a member of the Pediatric Association of the Gambia. Today, the 19th of June, is World Sickle Cell Awareness Day, and it was established by the United Nations General Assembly in 2008 in order to raise awareness about sickle cell disease among many other medical conditions. It was first celebrated on the 19th of June 2009. Today, the 19th of June 2020, the Pediatric Association of the Gambia is celebrating World Sickle Cell Awareness Day in order to continue raising awareness about sickle cell disease and its complications. What is sickle cell disease? It is an inherited disorder of hemoglobin. It is also an autosomal recessive disease, which means both parents need to be carriers for their child to have the disease. The disorder makes the red blood cells fragile and easily broken when exposed to certain environments and unfavorable conditions, including extremes of temperature, too hot, too cold, certain drugs, dehydration, and even infection. What are the signs and symptoms of sickle cell disease? The signs and symptoms usually appear around 5 months of age and above, and it includes pain, which can be severe, mild or moderate, anemia, swelling of the hands and feet, jaundice, enlarged abdomen, which could be secondary to engorgement of the liver or spleen, and even stroke as early as 2 to 16 years of age. Sickle cell disease is a major cause of absence from school and psychosocial stress. The diagnosis of sickle cell disease is done by a lab test called the HB electrophoresis, which shows the type of genotype. How do we treat sickle cell disease signs and symptoms? The treatment is based on the clinical presentation at the clinic, and it includes pain management, treatment of fever if it's secondary to an infection, antibiotics are given. Also, antibiotics are administered. Rehydration with fluids, blood transfusion if there is an indication, with a follow-up treatment with folic acid as prescribed by the physician. For stroke prevention, hydroxyurea is recommended with monthly blood transfusion. What are some of the control measures we can take in order to prevent these signs and symptoms of sickle cell disease? Avoid exposures to unfavorable conditions. See a doctor if your child has an infection or is in severe pain at home. Make sure your child is rehydrated with oral fluids. Take medications as prescribed by your doctor. Make sure your child receives all the necessary immunization, and make sure your child attends clinic regularly. Sickle cell disease is severe enough to cause multiple organ damage. Therefore, in the prevention of sickle cell disease, genetic counseling and screening is key. Seek medical advice before getting married in order to prevent sickle cell disease. Thank you.